You know how some carriers give you so little for your older busted phone you just end up living with it? I don't think so. Verizon lets you trade in your broken phone for a shiny new one. You break it, we upgrade it. You dunk it, doggy bone it, slam it, wham it, strawberry jam it, we upgrade it.
Get a 5G phone on us with select plans.
Every customer, current, new, or business.
Because everyone deserves better. And with plans starting at just $35, better costs less than you think.
Hey, folks, today is Monday, December 20th, 2021, coming up on Roland Martin Unfiltered right here on the Black Star Network. Omicron variant responsible for 73% of all new COVID cases. Senator Elizabeth Warren, Senator Cory Booker, Supreme Court Justice Brett Kavanaugh, yours truly, all tested positive for COVID over the weekend. And we'll talk with two of our experts about this new variant and why is it so contagious and why is it spreading so fast all across the country. Speaking of spreading fast across the country, the stupidity of West Virginia Senator Joe Manchin is on full display. He went on Fox News yesterday to say he was voting against the Build Better Back plan. Well, the BBB plan for President Joe Biden. The White House not happy at all, lighting into him what is next for the country when it comes to this very issue. That's one of the things that we're going to be covering on today's show. Also, we'll be breaking down, folks, on today's show. What also is happening on Capitol Hill, the battle over voting rights, that continues. This battle continues for voting rights. And so the question is, can you actually get a bill passed? Senator Chuck Schumer has made it clear he is going to move forward with bringing it to the floor. But the problem you still face, a Senator Joe Manchin, a Senator Kristen Sinema, they have both made it clear they're not going to roll back the filibuster. And so Where do we stand when it comes to that? That's one of the issues we'll be talking about. Also discussing the Equal Act. That's one of the issues we're talking about there as well. Plus, the jury in the Kimberly Potter case. That is, of course, the former cop who shot and killed Daunte Wright is now in their hands. We're going to give you an update on that as well, folks. A lot we're going to be talking about right here on today's show. It's time to bring the funk on Roland Martin Unfiltered on the Black Star Network. Let's go.
He's got it. Whatever the biz, he's on it. Whatever it is, he's got the scoop, the fact, the find. And when it breaks, he's right on time and it's rolling. Best believe he's knowing. Putting it down from sports to news to politics. With entertainment just for kicks, he's rolling. It's on go, y'all. It's Roland Martin, rolling with Roland now. He's funk, he's fresh, he's real, the best, you know he's Roland Martin now.
All right, folks. The World Health Organization says the Omicron variant is spreading faster than the Delta variant and is causing infections all across the world, even those who are vaccinated and have previously recovered from the virus. A lot of new mandates coming down. The mayor of Washington, D.C., Muriel Bowser, has reinstated the indoor mask mandate, declaring a state of emergency as a result of a record number of new infections. Also, there are booster mandates in D.C. As well. Folks, it begins tomorrow and it's going to go through January 31st, 2022. Now, here's where we stand in terms of the overall numbers. 52 million reported cases of coronavirus. Folks, since this pandemic started, 827,343 people have passed away as a result of COVID-19. Now, according to the CDC, 61.4% of the population in the U.S., they are fully vaccinated against COVID. Now, remember, fully vaccinated means 2 shots. Now they're talking about adding the whole idea of the booster to now actually meaning fully vaccinated. When you add that in, that number drops in a significant way. So what is it about Omicron that makes this thing so different? Joining us right now, Dr. Tyson Bell, a critical care and infectious disease specialist from the University of Virginia. Dr. Joseph L. Graves, Jr., Professor of Biological Sciences at North Carolina A&T. Glad to have both of you on today's show. So, Dr. Bell, I'll start with you. This is what Omicron is doing is shocking. Frankly, a lot of folks who say they did not expect to see it to be this contagious. I posted this on social media. I tested positive on Saturday after testing negative on Thursday. And when my symptoms started on Wednesday, my doctors traced it back to essentially I probably was infected when I was on vacation in Hawaii. And so I want to ask you that because, again, a lot of people, we have all of these people who have thrown all kinds of different stuff out. And so let's sort of deal with that. How are you tracking when you think someone may have caught COVID? Is it 10 days back from they first have symptoms? Exactly. How do you all make that determination?
Well, good question, because you can't really tell what variant you may be infected with based on symptoms alone. And
right.
The testing, very important, right? So depending on if you have symptoms, that's your day 0, so to speak, or when they start, or if you don't have symptoms, it starts from when your test was positive. So that's when that quarantine period starts. But there's not really a symptom that would make one think that you have Omicron versus Delta. Frankly, they're both problems. So it would start from either symptoms or your test.
But isn't this also part of the problem? Because, so perfect example, I had a scratchy throat on Wednesday. We did the show on Wednesday from Atlanta about 9:15. I said, man, give me something to drink. I said, my throat is scratchy. And then, went back to our Airbnb, woke up. I had some chills. I took a home kit test. It was negative. Take the next test 36 hours later. We have a staffer who actually diagnosed with bronchitis, Then, of course, again, clear, but all of a sudden over the weekend, test positive for COVID. You have some others who say they think it's allergies, or they think it's a cold. And so it's sort of like it's just difficult, folks, to understand that that all of a sudden, if you get a symptom, folks are saying, well, okay, what do I do? Do I immediately shut down? Do I immediately isolate? If I, like in my case, I had a symptom, but then I test negative. So what does the person do?
Right, and you actually, that's goes to an important topic, that there are some signs with some of the rapid tests that in the early days of Omicron, they may not be as good as picking up on infection. So the PCR, or the laboratory test, that's the one that you might have to go to a clinic or a doctor's office for. That's the one that's the most sensitive. That's the gold standard. So if you have symptoms and that rapid test is negative, I wouldn't necessarily say that we're done with it. I would try to get that follow-up test.
And see, and so I'll give you a perfect example. So I'm in Atlanta. I was calling all around, could not find a location to get that PCR test. Where we are right now in this country, we're seeing massive lines all across the country. We're seeing home kits being sold out. Here we are about to go into 2022. And frankly, we as a country still have not been properly positioned to confront this pandemic. I mean, the fact that people are, I'm seeing videos of people, 100, 200, 300 people in line, cars backed up, unable to find locations. I mean, we are still behind the 8 ball on this for some reason.
I mean, there's a lot of blame to go around. I would add, in addition to the lack of rapid testing for everyone, we don't have the sequencing capability that other countries like in the UK have in order to even pick up on the Omicron variant. So there's a lot of things that we need to be doing better, and expanding rapid testing is definitely one of them.
First of all, Dr. Grace, I want to bring you in. So when we had you on last year, one of the things that you made clear, was that, look, you're going to have these variants. So what exactly is the Omicron variant? And when I see this story, to say the Wall Street Journal had a story right before I came on that 73% of all cases are now Omicron variant. First of all, how do you know that? And what makes this so different?
The only way you would know that is by sequencing the patients. And as Dr. Bell pointed out, in the United States, our sequencing efforts are really not up to snuff. But what we do know at this point is that the Omicron variant is 5 times more transmissible than the Delta variant. And the Delta variant was very transmissible. And so, I hate to sound like a broken record, because you and I have been having this conversation since the beginning of this pandemic. And I have consistently warned people that unless we drove down the number of infected individuals in the United States and worldwide, we would continue to see the evolution of new variants. And in the case of the Omicron variant, there are close to 400 mutations in the spike protein. And that's why it's, on one hand, more transmissible, but it comes at the expense of being less virulent. But that's not a reason to celebrate, because it's still quite deadly, particularly for people who have pre-existing conditions. And also, the Omicron variant has the capacity to continue to evolve such that it may retain its transmissibility, but also then gain the sort of virulence that you see in the Delta variant. And so, we're back to square one on some really basic things, which are people in the United States need to begin to take COVID seriously. And if we don't, if we continue to be a culture of chicken little, actually there's a wrong analogy, I'm looking for the ostrich with his head in the sand, this is going to continue, and more people are going to die. It's really that simple. And
okay, so what you laid out there, and so if it is, and first of all, why is it 5 times more contagious? And with that the case, and look, I've gotten text messages from people other individuals who are prominent, who have actually tested positive, who have not gone public like I have. And I mean, I've had folks who said they've been at other events, and then next thing you know, these things have turned into super spreader events. And so for people out there, okay, what should we be doing though? What exactly should we be doing?
Well, it's easy to explain what we should be doing. And that's, again, people in public health have been making these arguments for a long time now. And that is, we need to continue with mask mandates. We shouldn't be gathering large groups of people, particularly with the Omicron variant now beginning to take over COVID transmission. We should not be gathering large groups of people in closed spaces. It's just a wrong idea. And once again, Roland, I hate to say it, but we're at a place where folks are thinking that their money is more important than people's lives. And so they don't want to face the hard truths of this is a very dangerous virus that will continue to evolve and may get even worse than it currently is, either with regard to its ability to transmit or its ability to make people really sick. So unless we are willing to say that we as a nation are going to take the political and moral courage it takes to put an end to this pandemic, we're going to keep going on this merry-go-round of things getting slightly better, and then everybody wants to open up, and then all of a sudden a new variant comes along, and then we're back in crisis mode. I mean, here in North Carolina, hospitals are already beginning to fill up with Omicron cases, and New York yesterday had over 21,000 cases. So it's this lack of a consistent policy, and it's a lack of this willingness to basically do what's right with regard to the health and well-being of people in the United States and around the world, which keeps us coming back to these conversations. And again, I feel like I'm a broken record, but this is a record that's going to keep playing as long as people are unwilling to do what we need to do to stop this pandemic.
So Dr. Tyson Bell, when we talk about, okay, how do we deal with it? Okay, so I just took my temperature, it's 97.9. Last week, it spiked to a fever of about 103. While in Atlanta, I took the monoclonal antibody infusion. Okay, so if we're talking about healing from this, and I can tell you for folks, they can actually hear my voice. In many ways, this feels like when I have allergies. Okay, stuffy nose, some congestion, don't have fatigue, don't have any of those things, and so here I am in my luckily I got a studio in my basement. So I'm here, wife's upstairs. So I'm locked off. So what is this then period? So let's say, okay, people all of a sudden becoming positive. How long then should they simply be self-isolating? What's that process? And how does one know you're getting better? What then happens?
Right. So the recommended isolation period is 10 days if you're positive. So that would either be 10 days from when your symptoms started, or if you did not have symptoms, 10 days from your positive test. You don't have to be completely better, but you should have your fevers. They should be gone by that point. You should generally feel your energy starting to come back. Again, you might not be at 100%, but if you're on that road to recovery, if you're on the mend and your fevers are gone without taking things like Tylenol or Advil or Motrin, then that's a sure sign that you're kind of kicking it. The usual infectious periods in the first week usually. So that first 3 to 5 days is when it starts, but then it goes down and the virus levels do for most people, assuming you don't have any immunocompromising conditions or on medications like that. So I would say 10 days for most people.
And of course, watching out to make sure no shortness of breath, things along those lines. There's no turn in terms of symptoms.
Exactly. And then while we're at it, let's just make one thing clear that the vaccine, I know you've received the vaccine, it's still working. I mean, the vaccines are never perfect. We never said that they were. They mostly are very good at keeping out of the hospital. I mean, it's not like you have antibodies that can run ahead and drop kick the virus before it interacts with you. Like you can still get sick. But the point is, it activates your immune system much earlier than it would otherwise, and it decreases your chances of having a serious illness, so that you can actually, be positive, have COVID, and you can do a show.
And the thing, I think the point that Dr. Graves you made is so on point, that the real issue that we have in this country, it has been schizophrenic. You've had all of these people who put pressure, okay, gotta open up, gotta open up, gotta open up. And then they say, what's the big deal? We got to move on. It's destroying the economy. It's all of that. But then, to your point, spike, so everybody's like, okay, my goodness, we got to like shut back down. And I just think I personally think that we're still operating behind the curve, because we had the idiots in the Trump administration who screwed this up from the beginning. You did not have massive testing across the country. The initial CDC test was a joke. Okay, it was problems with that. And so all of this talk, remember, people have the massive testing centers in parking lots, stuff along those lines. That didn't happen. Now you have people who've been saying that at the White House or the federal government should be sending home kits to every American household. I don't understand why that's a controversial thing if you're trying to deal with an international pandemic. Because, and then what did they say? Oh, the cost. I'm sitting there going, really? We just literally just passed an $8 trillion defense bill. And you're telling me you're talking about the cost of sending at home kits. And so not only that, that those antibodies, it was difficult. It was difficult to find when I was in Atlanta. I mean, we were calling all over. I was talking to Dr. Ebony Hilton, others here in Virginia, saying, well, what if I get it when I come back to Virginia? She was like, ain't not sure it's going to happen here as well. So here we still, as a nation, as our total infrastructure, are ill prepared for what is going on. And it's as if it's just like a patchwork every single day.
Well, again, protecting people from COVID is a national defense issue, and it needs to be treated that way. And again, I keep trying to bring home the fact that as viruses go, COVID is not as bad as what's out there. I mean, it's bad, but we have other viruses that can be next up in terms of their ability to become pandemic, and their symptoms and their mortality is going to be much, much worse than COVID. So if we don't put in place the biomedical research and medical public health infrastructure to deal with these emerging pandemics, the next time around, things could be really worse. And I also want to drive home that right now, the vaccines are holding up against the Omicron variant. But as the virus continues to evolve, there is a real possibility that we're going to get a variant that escapes control by the vaccines, and then we really won't be prepared. So we're at a moment, again, where we have the opportunity to try to get things under control, but it takes a concerted national effort. And folks that have been out publicly against vaccines need to basically change their tune. They need to start coming out and telling their supporters that they need to get vaccinated so that we can get this country back on track.
Dr. Bell, on that point, it was interesting when I posted on Saturday about testing positive. I had folks come on my Instagram page, others saying, well, I hope you're not sitting here mentioning that crap about vaccines. And I'm like, you damn right I am. I said, I don't give a damn what any of y'all critics think. I said, and I made it clear, every critic of the vaccine can literally kiss my ass. Because the bottom line is this here. There is no way in hell you're going to sit here and tell me that I'm not going to be trying to figure out every way to be fully protected. And that means the vaccine, that's the booster. I was scheduled to get my booster December 28th. But I still know someone who vaccinated and boosted who also got COVID. And here's the problem, Dr. Bell. I think part of it still goes back to when we first started. So many people were under the assumption or were led to believe that the vaccine was the cure. And so I think there's this whole deal here in people's minds. Well, you like I had some idiot, some loudmouth, who did a video on me. Oh, see, he out there promoting vaccines and he got it. I'm like, well, yeah, fool. Like, it's there. So explain. So I needed both of you to please explain to these loudmouth nutcases exactly what the purpose of the vaccine is. And it is not a cure. There's no thing that's going to completely protect you from not getting it. It is designed to ensure, frankly, you're not going to be on a ventilator if you do get it.
I think the easiest way to explain this is just to talk about what I've seen in my ICU. So if we look at last year and we were seeing the impact that it had, basically everyone, every age group, every demographic, disproportionately African-American, Latino, and underserved communities, as we talked about a lot on this show. But we rolled out vaccines to these communities. And now in my community, Black and Latino communities are highly vaccinated. So who are we seeing now in the ICU? It's unvaccinated people. I'm not seeing any more 20, 30, 40, 50, 60-year-old people who are fully vaccinated. It's all unvaccinated people. There are a few breakthrough infections and people who have these compromising conditions, but it is mostly unvaccinated people. So the face of the pandemic, at least for people who are severely ill, has changed in my ICU.
Dr. Graves?
Yeah, I mean, I really can't add to that because the facts and the logic of this are so clear that I'm trying to find a way to speak to someone who doesn't utilize logic at all to understand the situation. It's simple. The vaccines are effective and safe. We are now seeing that people who have been vaccinated and people who have gotten boosters are less likely to catch COVID. And if they catch COVID, they're less likely to get very sick from it. We also have a complete opposite case of people who are unvaccinated. They're more likely to catch COVID, and they're more likely to get very sick from it, and they're more likely to die from it. It's as clear as I would say the nose on my face. I don't know what else to say. There are things called facts. I mean, it's these anti-vaxxers are equivalent to people who are arguing, well, that actually the earth is flat. That's the type of argument that they're making, that the earth is flat. No matter what evidence you provide for them, they will still adhere to the idea the earth is flat.
I want you to reiterate that point again, Dr. Bell, what is happening now with our hospitals. I've seen numerous reports that the hospitals are filling up, and largely the people who are coming in are folks who are unvaccinated. Yeah,
I mean, I have just last week, we had a couple of young people that were in. So folks who are in their 30s, they have young children, they're unvaccinated. I ask everyone, assuming they're able to talk with me, I ask them, why didn't you get vaccinated? A lot of times as people say, I didn't think I needed to, I'm healthy, I take vitamins and things like that, that's good to do. But this is a global pandemic that has killed millions of people. And the vaccines offer extremely good protection from being severely ill. So it's the best decision you can make right now to go ahead and get vaccinated, because like I said before, what I'm seeing in the ICU are unvaccinated people who are getting critically ill.
All right, then, gentlemen, I appreciate it. This is one of the reasons why, we made a point from the beginning to have our top Black medical experts on talking about this stuff so people understand and they're getting real information. Dr. Tyson Bell, University of Virginia, Dr. Joseph Graves at North Carolina A&T. We appreciate it. Thanks a lot.
Thank you. Feel better.
Hope we don't have to do this again.
Well, guess what? I think we're going to have to, and we're going to keep hammering it. And for every person who keeps telling me, stop talking about it and stop promoting the vaccine, I'm going to tell them, shut up, because it ain't going to happen.
Sounds good.
All right. Thanks a lot. I want to bring in my panel now, Dr. Julian Malvo, Dean of the College of Ethnic Studies, California State University at LA, at the Omokongo Dabinga Professorial Lecture, School of International Service, American University, Reverend Jeff Carr, founder of the Infinity Fellowship in Nashville, Tennessee. Glad to have all three of you here. Look, if there's somebody out there who says, I don't want to take the vaccine, that's fine. Okay, everybody has an individual decision to make. The issue that I have is the spread of misinformation. I got these people talking about you need to have so-and-so on to debate this issue. And I go, are they a doctor? No. Are they a scientist? No. Why in the hell am I going to have a conversation about a vaccine with somebody who's not a doctor or a scientist? That's like me having a deep conversation about legal strategy with the same person, and they're not a damn lawyer. I mean, it is amazing to me with these TikTok doctors These YouTube scientists, people have no expertise whatsoever, and they want you to. I'm not debating this. I'm not debating 827,000 people are dead. I'm not debating that African Americans have died at a higher rate than any other group in the country. I'm not having that debate. Now, again, if you choose not to do that, that's fine. But I'm gonna tell you right now, I am absolutely going to encourage our folks to get the vaccine because, like I keep saying, Julian, ain't no flip side to death.
Hello.
There's no look. I'm being real clear. I don't like the fact that COVID is in my body right now. I don't like it. Okay, to think that there are 827,000 people, Americans, who have died of something that's in my body. Oh, hell yeah, that's scary. But if you think for a second I was gonna be walking around here not being vaccinated, you got to be out of your mind. Not finding that antibody and getting it done. Okay, and again, if you want to eat some fruit and berries and some vitamins and do a whole natural, again, that's his deal. There are people holistic, that's fine. But what I'm not going to do is I will never allow the misinformation and the putting on of people who are spreading that crap, because too many of our people fall for that conspiracy theory so quickly, Julian.
You know, Roland, I am so disturbed at the number of people who simply reject the vaccination. I applaud you for saying you're not going to debate these fools. And that's what I will underline, these fools. And I unfortunately have one or two of them in my own immediate family who refuse to get vaccinated because it's a white man's conspiracy. And I keep telling them white people dying from this too. But, you know, I don't talk to them about it anymore. You do what you do, just don't do it around me. And I think that's the issue, is the spreadability and the ways that so many people are infecting each other, so that those of us who've even been vaccinated can be unwitting spreaders. If the doctors are still there, I don't know if they are.
No, they're gone.
Okay, because I got to get on the airplane tomorrow. And I haven't had the booster yet because I can't find one. I've gone to 3 places and stood in line. Can I fly? You know? Actually, you can. So first of all, there's no requirement that you actually have to have the booster to fly. But the key is still taking all the precautions when you do fly. I've seen some doctors who've also said, hey, don't even take your mask off to drink or eat on the plane. Just wait till you land. I've seen that as well. Well, thank you. I will not. I will be sitting in first class sipping nothing.
Jeff, this is what is happening here, and again, it blew me away. And when we see these numbers, how the numbers just jump so quickly. New York City. How so many cities and states start reporting how Omicron just spread so quickly, and the fact that it is so contagious.
Well, when you talk about contagion, Roland, first off, I want to tell you this. I'm not a medical doctor, so I won't try to speak from a scientific space, right? I won't claim that. I will say that I am at an interesting crossroads where I have to put people in a space where they actually practice something that people seem to have lost in this day and age, and that's called common sense. When people see you and they hear you today, they hear you tonight bringing the funk. I'm glad you're bringing the funk. I'm glad we're bringing the funk today because, to quote the great George Clinton, you got to let the vibes flow through, because funk not only moves, it can remove.